Good evening, everybody. Welcome to yet another segment of Sukino Health Capsules. On this platform, we invite specialists from various fields of medicine to talk about their experiences and the various disease conditions and educate and make the common people more aware about all these conditions and how to manage them. Today, we have with us Dr. Chetan Kumar A, who is the consultant neurologist at Manipal Hospitals, Varthur Road, Whitefield. So, just a brief introduction about Dr. Chetan. Dr. Chetan has done his MD General Medicine from JLN Medical College, Ajmer, and also completed his DM Neurology from King George Medical College, Lucknow. His various areas of interest include stroke, seizures, migraine, multiple sclerosis, and geriatric neurology. And today we will focus on a very common topic, but where there is a lot less awareness about, and that is stroke. So, welcome Dr. Chetan. Good
Hi.
to have you at Sukino.
Thank you. Thank you for the kind introduction. So, yeah, stroke is a very commonly encountered subject in this point of time, and it's really important because I find that there's a lack of awareness in this field. Because when we talk about stroke, there's a very narrow time frame wherein the treatment will be effective, more effective. Okay, so it's a good thing that we are discussing this topic so that we can enlighten the people also about the various nitty-gritties of stroke. Yeah.
So, what exactly, so if we have to kick off the conversation, so what exactly is stroke? What are the causes? What are the risk factors? What really would you like to
So I'll just start off from the very basics of it, okay? Technically speaking, stroke is any kind of sudden onset neurological deficit involving any part of the body, okay? Sudden onset is a key word. You're fine and the very next minute there's a occurrence of deficit, okay? The deficit can be in terms of weakness in any hand, leg, or if you find any slurring in the speech, if the patient is unable to speak or comprehend, or it can be in terms of balance, he's walking fine and suddenly the next minute he is unable to walk, a lack of balance. All these are common symptoms of stroke. Okay. Another interesting thing about brain is, every part of brain controls different part of the body. If I talk about the right hand, my left brain controls the right hand. Okay. There's one area in the brain which controls that part. Similarly for the leg, similarly for speech, and there's one area for comprehension. Okay. So if someone says something to me, that part of the brain acts. Okay. So different blood vessels supply different part of the brain. So what exactly happens in stroke is the blood supply to that particular part of the brain gets hampered. Most commonly it is because of a clot. Okay, it can also happen if the blood vessel ruptures, okay, wherein we call it as a hemorrhagic stroke. Okay, these are the two things. Okay, and this basically encompasses stroke. Okay, so coming to the risk factors, who can get stroke? Stroke, anyone can get. Okay, every individual based on his inherent body structure, his genes, his family history is predisposed to certain illnesses. The same thing happens with stroke as well. Okay, so as I said, the clot forming stroke is very common. Okay, so there are certain conditions which predisposes. The most common is age. After the age of 60, every individual is predisposed to a heart condition, to a brain condition. So brain condition is stroke. Apart from that, there are certain modifiable risk factors. These are risk factors which we can modify, if we are controlled. First thing is diabetes. Diabetes mellitus, extremely common. Uncontrolled diabetics are predisposed to stroke as well as a heart illness. Uncontrolled hypertension. Hypertension is a very common illness. Underdiagnosed, undertreated. Okay, a lot of people neglect it because it essentially doesn't present with any symptoms. Okay, so this is another risk factor. The third thing which people call it as cholesterol problem. It is a dyslipidemia. There are multiple parameters. When we talk about a cholesterol issue. So any derangement in that is another risk factor for stroke. Apart from that, there are certain less common issues. People with certain genetic histories. There are certain people who are predisposed to clot formation, okay, due to their inherent hereditary problem. Okay, apart from that, there are certain heart illnesses. Okay, we would have heard about a problem in the valve, a hole in the heart, they call, yeah. All these people are predisposed to develop stroke. Okay, these are the classical risk factors of stroke.
We see a lot of patients getting younger and younger who are suffering from stroke. So, is there a particular reason why you're seeing so many young patients with stroke? Is there any particular cause that is affecting them, or is it just the lifestyles?
Yeah. See, the world has changed dramatically over the last 20 years. When we go back, when we compare our childhood with our children's childhood, we feel that they are pretty mature. Fine. With that maturity, they also inherit the tendency to develop certain illnesses which comes with that maturity. Okay. So the world has changed. The stress involved has changed dramatically. The atmosphere around us, the pollution has increased. Okay. The stress levels gives rise to one more stress-related illnesses. The lifestyle has changed. If you look at the youngsters, the amount of smoking, alcohol, late nights, everything has increased of late. So all these predispose to development of stroke. Apart from the conventional risk factors, there are certain non-tangible risk factors. Stress is something which you cannot quantify. Okay, pollution is something which you cannot quantify, but these are somehow adding on to it. And on top of all that, COVID has just complicated the whole picture. Okay, I'm not sure whether it is the awareness which is leading to the diagnosis, or COVID is directly contributing to stroke. But of late, we see that a lot of people develop stroke and heart-related illness, especially the youngsters.
That's right.
Yes, unfortunately.
So now that when someone does get a stroke, we see a lot of patients are not able, or relatives, attenders, their close ones are not able to identify when there's been a stroke in the patient. What are those factors which we can tell our audience that these are the things that you need to look out for? These are the things that are alarming. These are the things where you need to move the patient to a hospital, and these are the first early warning signs of stroke.
Yes, it's a good question. See, heart attack and stroke both are similar. Okay. A clot blocks a vessel in the heart, it's called heart attack. The same thing if it happens in the brain, it's called stroke. Heart attack, the alarming thing is people develop a severe chest pain. Okay, so that forces them to the hospital. But in case of stroke, it is invariably weakness which is painless. Okay, people have this tendency to associate it with a lot of other things. I slept on my hand, probably that's why my hand is weak. Probably I'm having a gastric issue, that's why I'm unable to speak well. So we associated all these symptoms with something very simple and trivial. So we neglect visiting the hospital on time. Okay, so it is very important for us to understand that these symptoms might not be as trivial, and the time we lose at home, it will cost us dearly. Okay, so yeah, that's what.
Yeah, so that's important. I think the time frame within identifying the relative, being able to figure out that this person has got something something different going on.
Yes,
it could be a stroke. I need to move him to the hospital at the earliest. What is a good time within which you can actually make a difference to this patient, that his recovery is going to be good if you are able to move this patient to a hospital in a certain amount of time? I'm sure the audience would want to know these important points.
Yes. So when we talk about stroke, there's something called as golden period or a window period. Okay. So it is a time frame wherein the stroke medications act best. Okay. There's something called as clot buster. To make it very simple, we call these injections as clot busters. Okay. So they can be used only within a limited time frame. Say someone has developed a sudden weakness on one side, say at 9 p.m. at night. So if he reaches the hospital on time, within 3 hours, he is eligible for this injection. Okay, that's when the injection acts. So if he postpones a visit, so if he thinks maybe till tomorrow morning we'll wait if it improves, and he comes tomorrow, the next day morning, he is not eligible for this injection. Okay, and there is no way his deficits is going to improve immediately. So my request, my humble request with everyone, is to identify the symptoms of stroke. If there is anything different, anything unusual in the way you see your colleagues or your family members, bring them to the hospital immediately, because timely intervention will change the outcome dramatically. To give you an example, we came across a 36-year-old patient. Okay, he developed sudden onset weakness on one side of the body. Luckily, he was staying very close to our hospital. He developed the symptoms. The family members were aware. They rushed him to the hospital. Okay, they came in, got a CT scan done. We got an MRI. We detected a stroke. Within 1 hour, we gave that clot buster. Okay, so within few hours, we saw signs of improvement. The next day, he was able to walk. A person who was completely paralyzed on one side of the body was able to walk the next day. Can it be more dramatic than this? Definitely not. So this, is possible only when you reach the hospital on time, or else it's very difficult. Yeah.
So I think the takeaway message for all of our viewers here is that identify it correctly and move the patient to a hospital at the earliest.
Yes.
So movement quickly is very important.
Yes.
So there's a lot of misnomers, miscommunications. People think all strokes you need to get operated, you don't need to get operated. What are the different types? How do you manage some of the strokes? Does everything need surgery? Some of them don't need surgery. Could you elaborate for our people?
Yeah. See, stroke, the word sounds very dramatic. Okay. Basically, it's a simple clot sitting in the brain which needs to be opened up. Okay. So the severity can vary. A stroke can be as simple as a slight slurring in the speech. It can be as severe as a person going into coma. And there are cases in between, weakness involving a hand, weakness involving a feet, or slight weakness involving half of the body. The management depends upon the size of the clot and extent of the brain tissue which is getting damaged. Okay, so I'll give you one more interesting perspective about stroke. Okay, we have nearly 80 billion neurons in our brain. Okay, 80 billion neurons. Okay, so if someone gets a major vessel stroke, every minute he'll be losing 1.9 million neurons every minute. Okay, and every hour he'll be aging by 3.6 years. Okay, generally, as we grow old, we tend to lose neurons. The number of neurons we lose in 3.6 years will be losing in 1 hour if we delay. Okay, this is how we, create that awareness. When we talk about people are, pick up numbers pretty interestingly. So we talk about the, extent of damage which can happen if they delay. So yeah, so extent of damage will increase if the size of the clot is more. Okay, so reach the hospital on time. Okay, and regarding the other question, what are the interventions which we do? A simple stroke can caused by a simple clot will be broken up by the injection. It's called a clot buster. Okay, there are certain cases wherein the clot is very big. It is blocking a major vessel of the brain. Okay, that's when we need to go inside. Okay, there's a procedure called as mechanical thrombectomy. With respect to a heart illness, there's something called as angioplasty, which everyone is aware of. It's the same procedure, but we go into the brain vessel, break the clot, remove it. Okay, if required, we place a stent so that the perfusion, the blood supply which is stopped, which is cut off, can be restored. Okay, and the recovery again depends upon the time. Early intervention is good outcome.
Right.
Yes.
We see a lot of patients having had a stroke, coming back during the recovery period or maybe later, again having another stroke. So recurrent strokes is also we do see patients like that. So what is the reason? Why do you think that's happening?
Yeah.
Or is there some way we can prevent it?
See, recurrent strokes, if someone goes with a stroke, he comes back again. Okay, there are multiple reasons for this. We need to see what are the risk factors which are predisposing him. Commonly what we see is people take medications regularly. They take it for a week, for a month, then they get better, then they stop it. Okay, if the risk factors are not under control, if he is a diabetic, if he is not maintaining it well, if he is a hypertensive, again not maintaining the medication, or he has stopped all the medications. Some people have this tendency to get overconfident. They somehow have this concept of side effects associated with medications. They have this preconceived notion. They feel medication for lifelong is not good. They stop by themselves without any consultation. This is one of the most common cause for recurrence. Apart from that, of course, there are certain people who have certain heart illnesses. Okay, there are certain rhythm problems of the heart which predispose to clot formation. Okay, even that can trigger a recurrent stroke. If that is the case, there are certain investigations we do. We identify the condition and optimize the medications, optimize the clot medication, so that such recurrences, the chances of such recurrences reduce. But the take-home message is regular follow-up is very important when someone has a stroke.
So once the episode, the event is done, now you're left with deficits, motor deficits, sometimes verbal, sometimes, there are a lot of patients we've had who take a long time to recovery. Yes. What really will make a huge difference to this kind of a recovery? How do we shorten the recovery? What is important in a patient of stroke getting back to regular activities? I'm sure everyone would like to know.
Yes. See, having a stroke is a really traumatic thing for the patient. Okay, it has a huge physical as well as a psychological impairment which happens. Okay, first the patient has to get used to the fact that he has stroke. Okay, gradually over a period of time, the most important thing which he needs to follow is certain exercises. We call it as rehabilitation exercises, neuro rehab, to be particular. Okay, so what happens in stroke? He develops weakness. So the brain slowly recovers over a period of time, so that See, with respect to brain, there's one thing. If there's a damage which is happening to any brain tissue, invariably the brain tissue doesn't recover. It's the surrounding tissue which will take up the function. We call it as plasticity. Okay. Such things, the recovery, the chance of plasticity improving is more when the patient undergoes regular rehabilitation exercises. Okay. So it depends. The kind of exercises he'll undergo will depend upon the severity of the stroke. There are certain people who are like, completely paralyzed. Okay. For him, they have to be even more aggressive with the exercises. There are certain people in whom the speech is affected. Okay. Wherein we advise speech therapy. Okay, there are certain people whose comprehension is affected. Comprehension, so they won't understand anything which is being said to them. Okay, so there are certain speech therapy exercises which will help them get over it. Okay, the time frame required varies from individual to individual, and it depends upon the severity of the stroke. So the whole point is, we treating stroke in hospital is just 10% of it. Rehabilitation and regular intake of medication is 90% of recovery, wherein the stroke, 90% of the case wherein the recovery happens.
Okay.
Yeah.
And what about in case these patients are really, what other therapies can be? Is it just physiotherapy? Is it just neuro rehabilitation, or is there any other therapy that would make a change or speed up his recovery to normalcy?
There are multiple therapies, recommended ones are the ones we do in physiotherapy and neurorehabilitation. There's something called as transcranial magnetic stimulation which people undergo. Okay. Of course, there are some studies which show positive benefit, but of course it has not entered the mainstream yet. Apart from that, there are certain things which people can do at home. There are lots of people who won't be able to, come to physiotherapy. There are certain, during this pandemic, we have treated people over phone who stay in different parts of India, in villages. Neuro rehabilitation is better said than done, isn't it? So that's when we advise some simple exercises which they can do at home. We just tell them, if they have some minimum power, we just ask them to button and unbutton the shirt. We ask them to hold a screw, take a nut, screw and unscrew. That is one more simple exercise. Okay. The other thing is, I ask the patients to put a rubber band, just expand the hand like this, and these are the things which people can do at home if at all they are not having access to proper neuro rehab center. If they have an access and if they are able to do it, nothing like that.
Okay. And what about there is a you can call it a myth if you say, but most people would be like, if a patient has got paralysis, he's going to be paralyzed for life. Mm-hmm. Mm-hmm. What would you say to that? I mean,
our movies have a big role to play in, this, what do you call this? This taboo being set in, any stroke patient you see in the movie, he'll be like this.
Yeah.
This will happen if he doesn't do any exercises or if he doesn't do any rehabilitation. Okay. But it's not like that. The stroke, I told, there are multiple categories of stroke. Okay. There can be mild stroke, you won't even realize that he's had a stroke. Okay. Then there will be slightly moderate cases wherein, a person drags his feet and goes. But surprisingly, such patients also, even after a year of good physiotherapy, exercise and all, you won't be able to identify. It's only in around 10 to 20% of patients with major stroke who live with some deficit, but even they'll be able to carry on with most of their basic activities.
Okay. Any inspiring stories that you have to narrate to all of our viewers here?
Yeah, there are multiple cases,
stroke.
Stroke is a very dramatic thing. One day they'll be paralyzed, the next day they'll be walking, So we have come across many such cases. One interesting case, a 50-year-old gentleman, he had a major stroke, mind you. We saw him worsen in front of us. Okay, he had a major clot in one of the blood vessel in the brain, which was extending to the neck. So he was admitted, we gave him a clot buster, that didn't work, we went in, we did a mechanical thrombectomy, the clot was removed, okay. Despite that, his condition worsened, the brain swelling increased, okay. So when such a swelling increases, what we do is, we remove a piece of a bone, piece of a skull, so that we give some space for the brain to expand, okay. He was in coma for 20 to 25 days, he was in coma, okay. Gradually we weaned him off medications. He gained his sensorium. He was paralyzed on one side when he woke, when he started his recovery. He went home on a stretcher. He comes back 3 months later with the help of a walker, 4-legged walker. He comes back after 1 year walking with a, walking stick, single-legged walking stick, and he's able to speak normally. Of course, a little bit of slurring is there, which was unimaginable maybe say 2 decades ago. Okay, the advances in medical care has so much that the outcome of each and every disease has changed drastically, speaking positively.
Yeah. So these are inspiring stories. I mean,
Yes.
paralysis or stroke is not the end of it. A
Yes.
good early management, identification, early management, I think getting the right therapy
Yes.
and consistent therapy, I think makes a huge difference
Yes,
in
yes,
good
yes.
quality of
Yes,
life.
yes.
What are the latest advances in, let's say, stroke for diagnosis or maybe management or anything?
Yes. See, I'll tell you, each and every aspect, every investigation we do in stroke, as far as India is concerned, is an advancement. Okay, there was a time wherein getting a CT scan done was a privilege. Okay, now CT scan is present in every area, every sector has a CT scan facility. Every hospital has an in-house CT scan and MRI, most of the major hospitals. Okay, so if anyone gets a symptom, they can just walk into the hospital, get a CT scan done. There are stroke teams available. Okay, they can get the investigation done as soon as possible. Okay, and initiate the treatment. The clot busters, what I talk about, even these are one of the recent advances. It was not available for the common man till say 20 years ago. Okay, it's being more commonly used over the last 10 years. The next step I talked about mechanical thrombectomy, wherein we retrieve the clot mechanically. Even that is the latest advances. Of course, there are different types of stents being used. All these are nitty-gritties of this thing, but they have changed the outcome dramatically. This is as far as the treatment part goes. As far as the investigation is concerned, we spoke about recurrent stroke. There are lots of advances. There is something called as transesophageal echo. We do an endoscope. We put a tube into the mouth, and through the esophagus, through the food pipe, we visualize the heart to see if there's any clot. If we find a clot, the medication is different. Okay, this is again the latest advances. Okay, and we see that certain young people get recurrent strokes. Okay, so there is a genetic testing there. There are certain clotting factors we see there. We figure out why the clotting is more. Even that is the latest advances. So recent advances in every spectrum of stroke care, be it in terms of therapy, be it in terms of investigations. All this has changed the way we manage stroke cases dramatically. During our MBBS days, we used to come across stroke patients who are mostly bedridden, and we thought that was the standard of care. As you said, stroke was equivalent with paralysis, a couple of decades ago. Not the case now.
Yeah. Yes. So finally, what do you have to say to our viewers? Any good takeaway messages for them?
Takeaway, there are a couple of things. Okay, again, I'll re-emphasize the same thing. When it comes to stroke, time is brain. Okay, the more you delay, the more you lose your brain neurons. Okay, if you find anyone with a symptom of stroke, which I discussed, bring him to the hospital immediately. Let the doctor investigate and decide the type of care which the patient requires. One thing. The other thing is stay healthy. Okay, staying healthy is easier said than done. There's a quote in investing which Warren Buffett says, investing is simple but not easy. Similarly, with staying healthy also, it's very easy to say stay healthy, but it's very difficult to follow because there are so many variables. Okay, there are so many non-tangible variables. We talk about stress, pollution and all that. So eat healthy, okay, and start move around. That is one thing. People sit in the chair, especially the IT crowd we talk about, they are mostly on chairs. Okay, so I request them to move around as much as possible. Climb stairs, avoid lift. Okay, at least two stories per day. Then slowly they can increase it. Okay, when they talk about junk food, avoid it. I don't tell you to stop it. Maybe you can reduce it by 50%. Finally, there's something called as aggregation of incremental gains. All these positive things what you do will show its benefit after maybe say 1 or 2 years. So yeah, this is the secret of staying healthy. It doesn't involve any long-term medications. If you are healthy, make sure you continue to stay healthy by adopting these habits.
I think these are wonderful messages which all of us should invest in our health. And thank you so much, Dr. Chetan. It's been, pleasure. I think, a wonderful interaction, and thank you so much.
Yeah, thank you so much for inviting. Thank you.